particularly in light of all the news, recent, past, and future around H1N1, we thought this was a really good opportunity to not only introduce our new visitor policy during the flu season, but also to give you an opportunity to ask some questions and for our experts to provide some information, particularly around what we're calling our 3 Ps, preparedness, precaution, and prevention. So with that, we're going to have Dr. David Biebinger kick it off, and then we'll go from there. So thank you.
Thank you.
I'm going to get out of Brandon's way.
Well, members of the press, thank you for gathering today and helping Health Alliance reach out to our community in regards to the H1N1 influenza epidemic. We at Health Alliance take seriously our role here in maintaining the health of the community in Leominster and also surrounding communities. And with that in mind, we have called the press conference today to inform the general public about the need for each person to take steps to protect themselves from the virus. We also want to emphasize a change in our hospital's patient visiting policy, and you'll see that displayed on the yellow board over there. A final point of emphasis will be on the role of diagnostic tests and anti-influenza medications in the management of patients with influenza-like illness. So, effective today, the hospital's patient visiting policy is listed over there. We request that members of the community abide by the following guidelines. Only immediate family should visit the patients, and these include spouses, partners, parents, grandparents, and children aged 14 or older. The next point is that children under 14 years of age are asked not to come to the hospital unless they are patients. The next point is that only 2 visitors at a time should visit the patients. And individuals with fever, cough, or respiratory symptoms should not visit at all. People in contact with someone with flu-like illness in the preceding 2 days should not visit patients because they may be carrying the flu and therefore may be contagious. So, we remain concerned about the H1N1 influenza epidemic and have taken the steps of calling this press conference in order to focus attention on these concerns, as well as the general good recovery that has been observed in infected patients. While the severity of the disease is somewhat unpredictable, for any patient, cautious optimism is appropriate for all who are ill or exposed to H1N1 influenza. It is important to know that while H1N1 illness is highly contagious, when compared to other flu strains, it doesn't appear to lead to a significant problem for most people that are infected. So, most people should not seek medical care if they develop an illness that resembles the flu. The most common symptoms are fever, cough, and sore throat. But other symptoms can develop, such as fatigue, runny nose, muscle aches, nausea, vomiting, and diarrhea. People with chronic illness that compromise the immune system or respiratory system, pregnant women, and children less than 2 years of age may wish to contact their primary care physician to get advice about their illness. We strongly urge the otherwise healthy population to avoid contact with the healthcare system unless specific warning signs develop. These would include a bluish skin color, not drinking enough fluids, or persistent vomiting. A flu-like symptoms improve but then return with fever and worse cough. Difficulty breathing or shortness of breath, pain or pressure in the abdomen, sudden dizziness or confusion, and a decrease in level of interaction. So I would like to emphasize to the public the appropriate role of diagnostic tests for influenza. This week in our community, all influenza-like illness should be presumed to be due to the 2009 H1N1 influenza. We do not have access to tests specifically for the diagnosis of H1 influenza. The tests that are available for diagnosing influenza in general are not reliable and should not be used outside of the hospital setting, and I recommend against their use unless a patient is required to be hospitalized. Similar instructions are recommended regarding the use of specific anti-influenza medications, namely Relenza and Tamiflu. Their general use is discouraged and is restricted primarily to hospitalized patients and high-risk groups, as stated above. So, to summarize this, do not expect to receive a diagnostic test for influenza or treatment for influenza unless you fit into a high-risk group for complications or require hospitalization. Again, the high-risk groups are people with chronic illness that compromise the immune system or respiratory system, pregnant women, and children less than 2 years of age. To conclude my portion, our patients' health and safety is our main priority, and because of that, our best defense against H1N1 will be to perform the 3 Ps, prevention, preparedness, and precautions. Allow me to introduce Marianne Pappas, Director of Employee Health and Community Health and Education, to discuss key prevention tips.
As a nurse and with employee health, we're getting a lot of questions from our employees and from area businesses and employees on what to do to prevent the flu. With any type of flu, whether it's the H1N1 or seasonal flu, there are simple ways we can utilize to prevent it and lower your chances of getting the flu and spreading it. First thing is washing your hands. We have the hand wash station, but washing your hands with soap and water at home works out really, really well. Alcohol-based hand sanitizers should be used. One of the key things we're saying to people is before and after you go into anything, whether it's home, whether it's leaving work, and that's what we follow with patient care areas in patient rooms. Another thing is, again, do not take me squinting, cleaning items that have been touched. A good thing for that is, you know those Lysol sanitizers? If you walk around your office or even at home with everything you touch, it's a really good idea. Light switches, handles of things, your keyboards, that type of thing work out really well. So you, again, eliminate some of the spread of that. When my kids were little, what I used to do is I'd take a dish pan and I'd throw 1 part bleach, like a capful of bleach, and 10 parts water. And with that, they can't poison themselves or anything, so you know I'm not trying to kill my kids. They're still alive and they're older. But we'd take their toys and that type of thing and let them have this like play day with all their slimy things that them and their friends put in their mouth. Worked out fabulous. A little messy, but really nice. It was a great way to clean things and the kids have fun. Cover your nose and your mouth when you cough. That's the second thing, and that's really important. If you use a Kleenex, which we really advise, wash your hands after you throw the Kleenex away. And please throw the Kleenex away. All right, this is not thrown away. You have to put it into a dispenser. If you use just cough and using the elbow cough, you'll see more and more people do that. I mean, it's kind of fun. I mean, kids are doing it all the time. So coughing that way is very, very effective, and we like that. And the most important thing is, if you're sick, stay home. All right? You don't want to be going out and about. Getting the flu shot also can lower your chances of spreading the flu. Seasonal and H1 vaccines right now are in limited supply. We're using a priority basis for distribution of the H1N1 currently. But as the supplies become more readily available, the access to them will become available. And there will be flu vaccines this year for everyone, so know that. And practice good health habits. Getting enough sleep, eating well, staying active is all really important for everyday health, but especially in flu season. And also be prepared. You do not want to be, when you have the flu or you have a family member of flu, running off to CVS or Walmart or wherever with your sick child and getting the supplies you need. Some of the things that you need on hand are thermometers, fever medications, and that should be Tylenol or ibuprofen. You can get your cough lozenges, cough syrup, over-the-counter products, but if you are on any medications, make sure you read the labels and make sure they don't interact with anything else. Another good thing is to have like drinks on hand. I always suggest that you have those little Jell-O containers, applesauce containers, things that your mother had that made you feel better. You're not going to want to be making Jell-O, but if you have Jell-O, you might eat it. And that's what we have for tips. Dave is going to go over the emergency preparedness and how we at the hospital are being prepared. Thank you.
Thanks, Mary. Health Alliance Hospital has put into place a hospital-wide preparedness plan in the event of a system-wide or region-wide H1N1 flu outbreak. The plan is being overseen by the highest level of hospital leadership. It will enable staff to quickly mobilize and provide patients with their maximum assistance in the event of an emergency. We continue to update our employees on a daily basis. We are also trying to stay in, we are also staying in close contact with the community, other area hospitals, local Board of Health, the State Department of Public Health. We will continue to communicate regularly with the community with the latest and best information that we have. I'd like to introduce Gail Cormier, our infection control.
Thank you, David. I think the main thing in precautions is just to use a common sense approach. If you're sick, stay home. If it's going to become the flu, you'll know it very soon. If not, then if you're not running a temperature, then you can return to work or school. If you make sure that you call your employer, let them know that you do have the flu. That way that they can, be sure not to dock you or anything like that. In general, people should return to work 24 hours after they have had no fever without taking any medication that could lower their temperature. If you know somebody who's sick at home, please, and they have nobody else living with them, please contact them. Let your neighbors know that you're there if you need assistance, and make yourself available to them so that they feel that somebody is watching over them. And as we've mentioned, we're going to effectively immediately start these precautions. They're in keeping with what the UMass system is doing presently. We do have alcohol sanitizers. We're getting them out to all our entrances to the hospital. Our employees are always following hand hygiene, going in and out of rooms. They must foam in, foam out, and we'll try to watch our visitors as well so that they'll be doing similarly.